the federal government picks up a lot more of the financing than what the state does for the expansion population.
Expanding Medicaid here in the state of Missouri, it will not be part of the budget presentation tomorrow.
A Medicaid expansion would require lawmakers to make changes to the budget, but right now it's off the table for next year.
Color 10's Francis Lynn reports tonight that lawmakers and organizations around the state are still pushing for the expansion in the next election.
The reason we're in the good shape we are is because we're being accountable and fiscally responsible for how we spend money. I don't think expanding government programs is always the answer.
Governor Parson made it clear in his State of the State speech last month that Medicaid expansion is not a priority.
Republicans have made it very apparent that here in Jefferson City, they are not going to pass expansion through legislation. And that's why we're seeing the citizens themselves going to initiative petition to get to a vote of the people to try to get it done.
Healthcare for Missouri and the Missouri Budget Project both support Medicaid expansion.
Right now, these hardworking Missourians are having to choose between putting food on the table or being able to see a doctor. And that's really what the choice is about.
Right now, the state pays 35% of Medicaid costs. Under expansion, that's reduced to 10% of the total cost. And many of the folks who are currently eligible for Medicaid would move into the expansion population, so we would actually reduce our state costs.
But House Speaker Elijah Harr and House Budget Committee Chairman Cody Smith oppose the Medicaid expansion. They say it would take money from education. Representative Quaid disagrees.
And they keep going back to the fact that it's just going to cost a whole bunch of money. But I will say that there are multiple studies that have now confirmed that expanding Medicaid will actually save the state money.
3 Midwest states that are fairly conservative, how they've actually used Medicaid expansion to free up general revenue so they can use that on other priorities like education.
And Missourians will have a chance to be the 37th state to expand Medicaid in the upcoming November election.
Folks who have health insurance are more likely to access preventive care, more likely to be healthy, and therefore avoid more costly emergency room.
When someone has a stroke, when they have a heart attack, having to drive an extra 45 minutes, an extra hour to a big city hospital could literally be the difference between life and death.
Francis Lynn, Ozarks First.